Okay, good morning, everyone. Thank you all for coming. Welcome to those who have attended here in person, and also I believe we have a lot of attendees online as well, so welcome to you both. Just a bit of housekeeping initially. I would ask everyone to make sure their phones are off, and if you give us 60 seconds of your time, we have a short video on the health and safety requirements just for those who are in person, which should come on now.
Ladies and gentlemen, may we please have your attention for this public safety announcement. This is the main conference hall. The conference hall has 3 emergency exits. Exit signs will remain illuminated at all times. Please take a moment to check the exit nearest you, bearing in mind that it may be behind you. In the event of emergency, you will be asked to proceed to the exit and move up the stairs to the assembly point located in the lower castle yard beside the church. For your convenience, restrooms are located outside the main entrance to the room. Please ensure that mobile phones are switched to silent while in the conference hall, and remember that Dublin Castle is a no smoking and no vaping building. If you are using headsets, we would request that you return them to where you found them when you finished.
Also, because we have people watching online and people in person, we have a Q&A session at the end of the speakers, and you can ask questions, but we would ask that you put them onto Slido, and there's the code there, so 3704510.
Good morning, everybody. I'm delighted.
Sorry. Sorry. Thanks. Sorry, that's the code. So 3704510. And also those people who are watching online can put questions into the comment section, and we'll pick those up and we'll ask the speakers at the end of their sessions. Just to say then as well, so the first half of this day, we have 3 main speakers. We'll then have a Q&A session, we'll have a break for lunch, and then we go into the workshops. I think there are 4 workshops online, there are 6 workshops here in Dublin Castle. And also I'd like to welcome Ethna Fitzgerald, who has kindly agreed to moderate today's session for us. Ethna doesn't need any introductions to this group at all. She has been involved in the disability research and policy reform for many, many years. So I'd ask Ethna now to introduce the speakers. Thank you.
Thanks very much, and you're all very welcome. And the purpose of this day is to hear from people with disabilities what you feel about these proposals. So this is your day. So the Minister is going to speak to us by video. So she's going. We now move with this.
Good morning, everybody. I'm delighted to welcome you all to today's event and to continue this important conversation on reforming disability payments. I'm very sorry that I cannot be with you in person today. As you know, I have attended previous events for the Green Paper and I have met with many stakeholders. I listened closely to your views and feedback on the paper's proposals. The objectives of the proposals are to increase people's payments and provide more employment supports for people who can and want to work. And I want to assure you that nobody will lose their payment or have their payment reduced. I place a high value on public consultation events such as today. It gives us the opportunity to listen to you, to hear your thoughts, experiences and suggestions on how to improve the current system. Your input will directly feed into the final proposals which we will present to government. I can assure you that no decisions have been made and that the proposals in the Green Paper are just proposals. I am not wedded to them, and if you think there are better solutions, then tell us. My officials are here today to explain further the paper's proposals, answer your questions and help make today's workshops as productive as possible. Note takers will record your feedback in the workshops, so you are directly feeding into the process to reform disability payments. Submissions may be made in writing or by video through our webpage. The current deadline is the 15th of December, but I am open to extending the consultation period if needed. So have a productive session and Guramila Mahigav Golair.
Our first speaker today is Christopher Prince from the OECD. Chris has been working on disability, employment and welfare issues for over 20 years. He's authored 30 papers. He's been very involved in reports in relation to disability services in Ireland and supports in Ireland. And he brings a wealth of experience through his work in this area. So, Chris.
Thank you very much, Aitne. Good morning, distinguished audience. I'm very happy and pleased to be here. It's always a great pleasure to be part of such important events. Disability reform is a very difficult task and also an important task. I've always been very interested in following it, and with all kinds of our OECD member countries. The OECD has 38 member countries at the moment. As Aitne said, I've been involved in disability policy issues in Ireland several times over the last 20 years. And in that sense, first of all, many thanks to the organizers for having me. It's not obvious that you would invite an international expert to such a concrete consultation process. The title of my presentation, as you can see, is Do's and Don'ts in Disability Policy, Key Lessons from OECD's Work, and How They Are Followed by Member Countries. So what you can tell from the title is I'm not presenting an assessment of Ireland's reform plans. So I'm not really commenting the Green Paper very much. Instead, I'm providing general considerations around disability policy and challenges that any disability reform is actually facing, Ireland as well as in other countries. Reason also being that the OECD has not been involved in any way in the preparation of the Green Paper or the current reform in Ireland. Although, as I said, I had been preparing reports on Ireland in the past, sometimes in comparative context with other countries, but sometimes really just for Ireland, including in 2008 and in 2021. I'm also giving you some examples from different countries around the world on the extent to which they have followed our conclusions and challenge thoughts around disability policy, or the extent to which they have not followed, because very often countries are not following. Going back to what I said in the beginning, disability reform is a very complicated matter, and therefore it is not straightforward to do a big structural reform. I'm also on different topics raising some questions for Ireland to consider, but for all of us to consider in thinking about reform. I'd like to start with a few charts around the outcomes of disability policy across the OECD. I would say probably the main aim of disability policy is to achieve a high degree of economic and social inclusion for people with disability. And of course, there's many ways of measuring economic and social inclusion. One simple way of measuring is looking at employment rates on the one hand, and at poverty rates, or the likelihood for people to live in households with low income on the other hand. So this chart here is showing employment rates of people with disability compared to the rates of people without disability. And in fact, this is showing the average across OECD countries. So it's the average across over 30 member countries. So it's a very broad story that I'm telling you here. And it shows the data from 2005 to 2019. Why 2019? We have done this work in the midst of the COVID-19 pandemic and have decided we want to take us the last year before the pandemic, because we didn't want the results to be influenced by what was happening in the pandemic. And what you can see very clearly from this chart is that employment rates for people with disability are much lower than for people without disability. And importantly, the gap in employment rates between the two groups has not really changed. Since 2005 to 2019, it's almost constant at about 25 percentage points. So you see the average employment rate of people with disability across OECD countries is 45% today compared to 71% for people without disability. Where does Ireland stand? Well, I think you're all pretty well aware that the outcomes in Ireland were very disappointing. The employment rate of people with disability in Ireland is much lower than on average across OECD countries. It's only around 30% compared to 45% on average, and way higher than that in some other OECD countries. So that also means that the gap in employment between people with and without disability is actually much larger in Ireland than it is in many other countries. And on top, the gap in employment rates has been increasing in Ireland, which is not the case on average across these countries. A second indicator showing very much the same picture, but the different information, namely showing you the share of people with disability and without disability who live in households with low income. Low income being defined as all households with less than 60% of median income, which is the typical poverty threshold used in research. Again, what you can see is the average across all OECD countries in the long-term perspective. And again, the gap in poverty rates between people with and without disability is very large, and it has even increased slightly over time. And in the year before the pandemic, across OECD countries, about almost 1 in 4 people with disability lived in households with low income, compared to about 1 in 7 people without disability. Again, results for Ireland are significantly worse, with 1 in 3 people with disability living in a household with low income, compared to 1 in 7 without disability. And again, the trend over time has been increasing in Ireland, so the gap, the disadvantage of people with disability has actually increased. A last chart, a last piece of information to share before I go into the policy debate is showing you the share of people in individual OECD countries who receive a disability payment, the share of people of working age. Disability payment in the case of Ireland means either disability allowance or invalidity pension. And depending on what systems countries have, so this figure might include several different payments. Some countries just have one disability payment that varies across countries. We could talk about that figure probably for an hour. I just wanted to give you 2 or 3 key messages. One is you can see immediately that the share of people receiving a disability payment is hugely different between countries. It goes from only 2% of the working age population in some, especially non-European countries, to over 10% in some countries, especially Nordic European countries and Baltic European countries. The second message, again, this figure shows data just before the COVID-19 pandemic, but also the little dots give you the same information a decade earlier. So you can also see the trend in the different countries. And you can obviously see the dots are all over the place. So you have as many countries that have seen an increase in the share of people receiving disability benefits as you see countries that have seen a decline in the share of people on disability payments. Essentially, I think both the changes over time and the huge difference across countries is also to a large extent explained by the fact that many people with disability actually receive other benefits other than disability payments. So in some countries, the main benefit people with disability receive is actually a disability payment, but there's actually many countries where it's much more likely to receive other payments. Could be early retirement payments, could be unemployment payments, or in particular, last resort social welfare, social assistance payments, which are very prevalent in some countries. Last piece of information, in Ireland, the share of people receiving a disability payment has increased quite a bit in the decade before the pandemic. Now with that, let me turn to some of the policy issues. I will present key lessons from 20 years of work on this subject with our member countries. I'll present 5 such lessons, and each of these lessons actually presents a massive challenge for policymakers and for disability reform. The first challenge, the first lesson reads, accurately assessing who can work and who cannot work is very challenging. It's a very simple and plain statement. It sounds trivial in many ways, but I think it's very much at the heart of the challenges of disability policy. We should not assume that we actually are able to identify and distinguish who is able to work and who is not. This is almost a false belief to think we can. So in many ways, what it suggests, well, any policy built on that assumption is already problematic in itself. Well, we seem to believe that we need an assessment to determine who is entitled to support and who is not, who is entitled to particular services or benefits and who is not. This is already problematic in many ways, not least because assessments are always very stigmatizing, and in particular also because disability assessment traditionally in many countries, including in Ireland, has been very strongly medically focused. So basically what countries do, they look at whether people have a health condition and impairment and kind of deduct from that what level of disability we believe this creates, which is not at all the same as the actual disability experience people are facing. Therefore, actually, the United Nations Convention on the Rights of Persons with Disabilities is asking for a big change, is asking countries to move away from this medical focus to a focus of people's functioning and performance. So in a way, people's real disability experience. Now, in this space, what is happening across OECD countries? Are countries moving in this direction? I think we can see two types of reforms being discussed, at least. I'm not saying that they're really happening. In most cases, discussion takes very long before anything is happening. So some countries are really trying to shift away from the medical perspective to a functioning approach of functioning and performance. But this turns out to be very difficult because it seems that societies in many cases are not really ready for this shift. It means that, well, yes, you need to have a health condition or impairment to qualify for having a disability in the first place, but the health condition is actually not very relevant for your actual disability experience. And I think that big shift in assessment, most societies are not yet ready to make. A second type of reform that we do see is exactly what the main lesson says, that countries try to identify those who cannot work, the aim being to change the system for those who can work. So basically concluding that our systems are actually not very able to support people into employment. So let us identify those who cannot work. For those, we leave the system more or less unchanged. And those who can work, we want to focus much more on employment support, provide employment services, but also implement some new conditionality so that actually seeking employment and taking vocational rehabilitation becomes is no longer just voluntary. So we do see quite a few countries which are trying that. Do we see countries doing exactly what the Green Paper is proposing by tiering and triaging people into different groups? I would say yes and no. Not really. There's no other country that really has this a system with these three groups that the Green Paper is proposing. As I said, we do have countries which are trying to identify whether you can or cannot work with all its problematic problems. There is also countries which have what is called a partial disability benefit. Quite a few countries have that, which you could say is a bit similar like that, because you try to identify whether you actually deserve a full benefit or just a partial benefit. But the result in many cases is people just receive a lower benefit. The system is unchanged. You just have one category that receives a full benefit, the other receives a partial benefit, assuming that these people will be able to work to some extent. While Ireland is trying to do this in a much more systematic way, and also systematically assigning conditionality, support, and payment levels to the different tiers. A second key lesson, somehow related to this first, and again, a very blunt statement, moving people off disability payments is virtually impossible. and this is a completely neutral statement. I'm not saying that this is an objective. I'm just saying the way the systems work, once a person receives a disability payment, they will never leave from that system. And I think that's a very important aspect to consider and simply to accept. We have to accept that that is the case and draw the right conclusions from it for our systems and for our reforms. And there's a couple of consequences coming with it. One of that would be, obviously, it's very important to focus on early intervention, because that might be actually a way to provide people better and prevent disability benefit claims. A second issue is to reconsider possibly the minimum age at which people can move onto a benefit which is quasi-permanent. And the quasi-permanent benefit that is very stigmatizing and in many ways an inactivity trap and the guarantee for a life in poverty. And the third aspect is that because of the nature of these payments, we should actually consider to offer benefits irrespective of the person's employment status to a much larger extent, what is called cost of disability payments. I'll come back to this, all of these issues later. The question is also, what is happening across OECD countries in this space? Do we see recognition of this second lesson, and how do countries respond to that? Well, first of all, a lot of countries are granting disability payments temporarily, initially. So when you claim it the first time, you can only get entitlement for a limited period, with the aim being to reassess again whether you're still entitled to it a few years later. This has become very common. In many countries, even only maybe 10–15% would initially receive a permanent payment, while all others, 80–90%, would receive a temporary payment. But in fact, this measure has absolutely no effect. What we see is that in all countries where this exists, everyone is eventually shifting from the temporary payment to the full payment anyway, so you wonder why you even have a temporary payment. Similar situation, a lot of countries have introduced payment suspension as an incentive for people who are on benefits to move into employment. So basically suggesting that if you try to work, you will not lose your entitlement, but you can actually keep your entitlement and move back onto benefit if your work efforts have not succeeded, or if trying work has not been the experience that you had hoped to get. Again, what we see is a lot of countries have introduced this kind of benefit suspension. And also in many countries, they have initially done this for a very short period and extended it for a longer period so that people could even try for several years. The reality is that the take-up of these measures is close to zero. So again, it's a measure that countries are taking without any impact. People are not interested in taking it up. Why is that? Probably a lot of trust issues and fear that you would lose benefit anyway. So you don't trust that this policy really holds. A third aspect is around policy to increase the minimum age of transfer to a permanent benefit. This is an issue that is part of the Green Paper, as you are discussing to increase the minimum age for disability allowance from age 16 to age 18. But some countries are going much further in that discussion, at least. The aim or the consideration being, well, maybe it's not good policy for anyone to receive a permanent benefit before age 30 or even age 40. Society should actually do much better than just providing a benefit to young people. And there is some discussions around that, which have often led to strong policies to focus on rehabilitation, medical and vocational rehabilitation, forcing public authorities to exploit all rehabilitation opportunities before they can even consider granting a disability payment. And in some countries, what they have done is even to introduce particular new benefits, like a rehabilitation benefit or a retraining benefit for people who are somewhere between the labor market and the risk of moving on to a permanent disability payment, to make sure that they are in a different status where there is actually a very strong focus on helping them fully recover and return to employment. These systems, the key issue will be in terms of what they deliver. We have seen that in some countries that has led to higher employment integration for some groups. But of course, in many cases, we also see it has not done much other than keeping people on these other benefits for a couple of years before they eventually move on to a disability payment. So the question is really, how seriously are you offering supports and services that allow you to get in touch with the labor market? A slightly provocative question at the end of this section. Should we consider removing all employment restrictions for people who receive a disability payment? In a way, that seems the logical thing to do. As we know, no one is moving off benefit. It would be an absolute win-win to say, well, you don't have to move off benefit. You receive your benefit and you look for employment as much as you like. It's a win for people because they will have more income, more integration, lower poverty, and it's a win for society through higher taxes and higher employment. Of course, such a policy would raise all kinds of issues related also to the issue of assessing in the first place. But one area where this might really would be worth considering is in the thinking around the transition to a new system, where you also have to think about, so what do you do with people currently in the system? And then we just heard from the minister, you have a guarantee that no one would lose any benefit, but would you also benefit from the positive elements of a reform is quite another question. And that could possibly be answered by a policy just suggesting, well, you keep your benefit, whatever it takes, and you get any chance to move into employment. A third lesson, and related to some of what I said before, cost of disability payments are absolutely essential in a good disability policy. This is very much related to all that I said before, because special work incapacity benefits are often problematic in many ways, including because they are slightly more generous than other benefits. They come without activation and activation requirements and conditionality. They also come without employment support. So they are often appear attractive and draw people into benefit without really securing either employment or sufficient social inclusion. And that's why we believe a cost of disability payment is actually a much better policy, much fairer, not hindering employment, and also making it much more likely to help people out of poverty. Now, the Green Paper refers to cost of disability payments quite a lot, which is really great. Ireland has also done a serious attempt to measure the cost of disability, and we will hear about this later today. But when I read these, I feel like I really wonder whether the system proposed is an answer to the key importance of cost of disability payments. I don't really think so. I feel like the three tiers touch on that very slightly, with very small difference between the three tiers. And therefore, my question, is Ireland considering actual real introduction of cost of disability payments in the true sense of the word, individualized and related to actual individual costs of disability? If I look around OECD countries, indeed, it is surprising that cost of disability payments, given how logically important they are, that they are not very widespread, in fact. A lot of countries don't have much of that. And if they have something like cost of disability payments, it's more like a supplement where everyone gets the same. So there's no real example of countries providing actual payments that directly relate to your real individual cost. So it seems like we're talking about how, so there's a lot of discussion how to assess. Well, let's look at your cost and make sure that we compensate those. This is not really the way cost of disability payments work in most countries. A fourth lesson, and it's in many ways also a main, maybe if I have to choose one, it would be my main lesson to share with you. It reads, early intervention is the single most important disability policy measure. Certainly, this is also closely linked to some of the previous lessons, as like lesson 2, that people never would move off a disability payment. And I feel like this issue of early intervention is not really addressed in the Green Paper, maybe by purpose. But our work shows that sickness and disability programs are closely intertwined, and therefore sickness and disability policy must be looked at together, and reforms must always look at both sides of it. What do I mean with early intervention? Well, empirically, we know that intervention must happen in the first few months into a long-term sick leave. We have data from a number of countries which shows that if someone has been on sick leave for 5 to 6 months, it is actually more likely that the person will leave the labor market altogether than the person would ever return either to previous employment or new employment. So the window to act and to help people stay in the labor market is actually very short. And the window is when people are on sickness benefit, or in the case of Ireland, on what is called illness benefit. After that period, we have actually missed that window. We have missed the opportunity to help people into employment. And we see that in many countries, like in the Nordic countries, for instance. They have enormous, rich and comprehensive employment programs, which are offered to people after several years of being out of the labor market, when it's too late to help people back into the labor market. Would these programs have been used years earlier, they could have had a much larger impact. And what do we see across OECD countries in this space? I think traditionally, sickness programs have been very passive benefit payment systems, but countries start to realize how important these programs are as return to work programs. So this is actually the area where the biggest changes are happening and where the biggest successes are being found. What is also important that if you think about sickness programs, you also have other stakeholders which are very important. One such stakeholder is the employer, who is critically important to help people return to work. Another key actor is the doctors, who currently, their role currently is to write people off sick by providing a sickness certificate, while their role should actually be to help them return to work as well, in addition to their role as a doctor. So what we see is quite a few countries have put in place what I would call a sickness management process with a structured series of obligations for the sick worker, for the employer, and for the doctor to meet and discuss and prepare a return to work plan to ensure that people can return quickly to the extent they are able to return. So it's a very important element that you can return flexibly, a few hours first, increase your hours in line with your recovery. So the key question for Ireland to consider, or question from me to Ireland, although I do know the answer, I suppose, is a reform of illness benefit also planned, which in my view, the answer should be yes. And it is critical to be yes to make the disability benefit reform a success. And reform of illness benefit would mean turn the benefit into an active return to work payment, which also in particular allows a gradual return to work. My fifth and last lesson to share with you, that goes way beyond disability benefit reform. It's basically, this fifth and last lesson is thinking the UN Convention on the Rights of Persons with Disabilities to its very end, because I'm sure you know the convention pretty well. You know that it includes statements such as countries have to abolish special education. Countries are miles away from that. Countries are asked to abolish sheltered employment to ensure actual real labor market integration. Countries are still miles away from that. We believe that to get any closer to the real objectives of the UN Convention, we need disability mainstreaming in all policies and practices. Sounds like a very trivial statement, and I think almost everyone would say yes, but what this really means is quite far-reaching. I think we really need to find a much better balance between special support and mainstream support. I think it's a big mistake that in many countries, disability policy is very much built around the notion we need special institutions that provide special interventions for special people. while this sounds like a very caring approach, it is also a guarantee for exclusion. And probably the opposite of what you do if you want to achieve real equality and inclusion for people with disability. So I believe we need the mainstream institutions as the main actors, and we need to make sure that mainstream institutions are disability competent first. Second, that they provide support to people with disability as much as to everyone else. And third, and maybe most importantly, that they are held accountable for doing so. I don't think that any of that is really in place. I think we can learn a lot from the analogy with gender mainstreaming, where we have made enormous progress, and both in terms of implementing it and in terms of the outcomes that we see. I think we need something like that also for the disability field. And mainstream institutions, what I mean is actually any labor market institution and any other institution too. Like in the labor market field, it's particular employment services, but also adult education services. So the question also is, more concretely for Ireland, are the public employment services and the adult education services disability competent? And when I talk about public employment service, I explicitly actually mean in TREO, which is the general arm of the public employment service and not the one providing special employment services. Because we also know from some countries, including Ireland, which have both a general employment service and a specialized employment service, that actually there's more people with disability on the general employment services than on the special services. If you don't service them well there, you will not succeed in your outcomes at all. And you will rather work towards separation than inclusion. Think of the green transition and the digital transition, which is now dominating our discussions in the labor market. It will be critically important that all the measures and tools and stakeholders involved in these labor market, big labor market transitions are fully disability mainstreamed. Let me end with one very simple statement. If we look for the best predictor for a high level of employment for people with disability in countries of the OECD, what we find that the best predictor is a strong, flexible, and inclusive labor market. So it's not better disability policy that creates higher disability employment. It's actually strong general labor market policy, which leads to higher employment generally and for people with disability. So in many ways, actually, people with disability benefit maybe even more than other groups from good general policy. And that's why mainstreaming is so important. I'll end here. Thank you very much.
Yeah, thank you, Chris. And it's great to draw on the experience of 38 separate countries, as well as a deep knowledge of what's going on in Ireland. Our next speaker is Brian O'Connell, who is an economist who has worked in the ESRI, and most recently he's been working in Indicon, where he was the lead author in the report on the cost of disability. And I think Chris gave an introduction as to why that's so important in terms of looking at reforms. I'd also like to say, if anybody wants a little comfort break or to pop outside for a bit of fresh air, there's a nice kind of garden area and pool just diagonally over there and out there if anybody feels they want a break from the intensity of these sessions. Thank you.
Been asked to use Slido to ask questions. I cannot use Slido, nor can Slido. Can I ask that basically out of respect to us who made the effort to come here, that there be an accommodation made? This is supposed to be disability, because if I'm autistic, I cannot go along and use Slido to pay attention. Peter has asked me to say that he can't communicate. So basically, can we actually ask that this be like what we always, and you also factor this in or after, and just a bit of respect for those of us who are going to be impacted, because it doesn't seem to be that don't be responded.
Yeah.
As a distraction to say a person discriminated that this wasn't on one of the plans.
Sorry, I actually say beforehand, no problem. We have staff in the room that you can answer questions. I'm sorry.
Yeah, no, look, we'll facilitate, yeah.
Just explain, we're happy to take that question. All the things that wasn't placed in the beginning, but thanks for raising it, and we'll put that in place in a few minutes.
So we have.
Yes.
Yeah. Thanks very much for raising that important point. Okay, Brian.
Good morning, everyone. My name is Brian O'Connell. As Etna said, I'm an economist with Indicon, and I'm very happy to be invited here today to discuss the findings. Apologies. Yeah, apologies. My name is Brian O'Connell, and the economist with Indicon. Obviously delighted to have been invited here today to discuss our research on the cost of disability. To give you a brief introduction to what we'll cover in the few slides, I'll give a brief few remarks on the research and the background to it, a short note on the methodologies we employed in coming up with the findings, discuss the findings for the cost of disability in Ireland, briefly outline the policy implications found in the study, and then a brief discussion of the implications for the Green Paper. In terms of introduction, then, Indicon we were commissioned by the Department of Social Protection to undertake this research, and the report itself was published in November 2021. Again, as I say, we're delighted to have been invited back to discuss the findings of that today. Also very pleased to see that the research has, along with other research and work, has informed policy and movement and the development of the Green Paper. The key aim of the research project we were commissioned to undertake by the department was to estimate the cost of disability in Ireland using complementary methodologies. That's to sort of come up with a triangulation, if you will, of evidence for the cost of disability in Ireland. The report then obviously built on these findings for actual quantification of the cost to come up with some key policy implications in that regard. And this presentation will summarize those key findings, and we'll briefly discuss the policy implications as well. As I said, a brief note on the methodological approach. So our approach was to triangulate evidence from a couple of sources. The two key sources were a statistical analysis as well as a major primary research survey exercise and stakeholder engagement. We engaged with 25 representative bodies, and our survey was completed by 4,700 individuals living with disabilities in Ireland. And obviously we're very grateful for everyone who did complete that survey. We believe it's the largest of its kind in Ireland, and also gave us a really rich data set to draw evidence from and give insight into the experience of people living with disabilities in Ireland. In terms of the statistical analysis, that was utilising data from the survey on income and living conditions collated by the CSO, which is sort of the gold standard data set in Ireland for incomes and standards of living, and this statistical analysis was undertaken using that. Before going into sort of the actual quantification of the costs, the key finding of the research was to look at just what did the cost of disability actually imply, and that CSO data set that I mentioned provided very obvious evidence on that. You can see in this table the far right hand side column shows the proportion of people in the sort of general population, those who don't report any illness or condition, who are reported as at risk of poverty or in consistent poverty, and the other columns have those rates for people with different conditions. You can see that those living with disabilities have significantly higher risk of poverty, and a significantly higher proportion are living in consistent poverty based on the SILC data, and that's just evidence of the sort of implications of the cost of disability. That CSO data was also very useful in looking at other measures of deprivation and challenges faced by people with disability. It found that those living with a disability face significantly higher proportion of people who reported struggling to make ends meet on a monthly basis, and also a number of other indicators of deprivation, such as an inability to maintain a warm home. So that's sort of, before we go to quantify the cost, those are the sort of the implications. In terms of the actual cost, then, this table, as I said, we used sort of multiple methods to try and triangulate a cost. We use the statistical method and the survey analysis. This table shows the sort of averages aggregate over the population for those who reported being severely limited in their daily activities by their disability, and those who reported being limited in their daily activities due to their disability. So the two methods provide a range. As you would expect, those who report being severely limited have a significantly higher cost of disability, ranging from about 11,800 to just over 16,000 euro per annum. And then those who are limited, again, the cost range from about 7,700 to an upper end of about 11,600. Now, it's important, and I'll say this when we look at other statistics as well, that these are aggregates, these are aggregate figures, these are population level figures. They mask a lot of variation. That's one of the key findings of our research, was that underneath these figures, there is a wide distribution of costs driven by the nature of people's disability, the type of disability they have, the number of disabilities they have, the age they are, and a number of other factors. So while these figures are population level, there is a very significant variation underneath that. And the next slide gives a little bit of insight into that. We were asked to look at the cost by type of disability. This slide gives the cost for about 10 conditions as listed in the census form. And you can see there are, they're broadly similar, but there are higher estimates, the higher average for those with difficulty learning, remembering, or concentrating, or digestive disorders. They have particularly high costs coming out in our analysis, but the range is broadly similar across all types of disability here. But again, these are averages. These are still population level statistics. They do hide a significant level of variation, driven by, as we've said, sort of the personal circumstances of an individual, their exact needs, the different nature of the costs they face, again, the number of disabilities they have, the severity, their age, etc. So while these figures are aggregated and informative, they do hide a lot of variation, and that was sort of a key finding of the research. Indeed, was that the real cost of disability is a very sort of personalized and individual level factor. Now, obviously, underlying those previous estimates, are what are the actual costs, what are driving these costs of disability, and we did provide some insight in that in our research on the key drivers of the cost of disability. Again, these are population level, so they're informative insofar as they show in the aggregate what's driving the cost of disability in Ireland. You can see the most significant one there is just the category of additional living expenses. So that would include everything from electricity costs to heating costs, laundry costs, etc. That's 40% of additional costs, again, in the aggregate. After that, then it's mobility, transport, and communication. That includes everything from additional public transport costs, or costs of taking a taxi, or costs of running an adapted car. That's all in there. Equipment, aids, and appliances. Care and assistance services are then about similar. Care and assistance services cover everything from respite care, physio, occupational therapy, etc. But again, to say these are population level, and for those. And we go into this in some detail in the research report itself, is that the nature of a disability, the number of disabilities, severity, very much impacts on what the key driver of those costs are. If you have a significant cost for, let's say, included in equipment, aids, and appliances is, if you need to make alterations to your home, if you have a very significant cost there, it's going to make a very significant percentage of your overall cost of disability. But in the population as an aggregate, we don't see that. So these statistics here are, again, aggregated, but they do hide an awful lot of granularity. They do hide an awful lot of nuance, and the fact that the costs in the aggregate and the drivers of those costs do very much change by the nature of disability, number of disabilities, severity, even geographic location, age. Those are all key drivers. So building on from those findings on just the level of disability and also the level of the cost of disability and the sort of distribution of those costs, the report made a number of key policy implications, lifted straight here, sort of go through them one by one and comment on some of them in the context of the Green Paper. Sort of key finding of the work was that there are significant additional costs faced by individuals with a disability which are currently not being met by existing programs or by social welfare supports. building on from that, then individuals with a disability face enormous challenges in living independently and face a high risk of poverty and social exclusion. We saw that in the earlier slide, and that slide was built on statistical data, but that was also a finding of the primary research and engagement with the disability representative bodies that certainly came out strongly. Thinking about the sort of measures to address these identified costs of disability, as I've said, at every stage, the costs we presented here are largely aggregate and population level, but we know from the research that they change by, as I've said, number of disabilities, personal circumstances, exact needs, and that really then the solution to that has to be a whole of government approach involving both increased cash payments, enhanced access to service provision in certain cases, specific targeted grant programs. So it's not a one size fits all solution. It needs a multifaceted response. And then sort of connecting into Chris's work, and we know in Ireland that we have a particularly low rate of employment amongst those with disability. And that came through in our own work. So individuals with a disability experience significant challenges in accessing employment in Ireland. That's borne out by the statistics presented, and also the feedback we had from engagement with people living with disabilities. And on foot of that, one of our key policy recommendations was that a high priority should be given to facilitating and increased employment opportunities for individuals with disabilities, both as a means of assisting them in meeting the additional costs of their disability, and also for, as I think Chris mentioned, sort of social inclusion and other reasons. Again, thinking then about the means of addressing the identified costs of disability, the key sort of policy implication from our report was that the concentration of any additional supports should be targeted on those most in need and those who face the greatest additional cost of disability. This not only represents a sort of best means of achieving value for money from the state's perspective, but also obviously in targeting those most in need, really can get the most benefit from any additional payments, rather than spreading thinly a sort of aggregate payment over those who may face relatively minor additional cost of disability compared to those most in need. And then the next point flows from that. The levels of disability payments and allowances should be changed to reflect the very different costs of disability by severity and type of disability. And then sort of flowing on from that and sort of tangential to the core elements of our research, where that there is a need to recognise the need of recognise the impact on families of individuals with a disability, and particularly loss of earnings and sacrifices made by families caring for those most in need. As I said, that was somewhat tangential to our key focus of the research, but it did very much come out in the research and the engagement of people with disabilities and their families that there is a cost to carers as well as those actually living with the disability. And finally, a key implication which we included was that, and again from the feedback with the representative bodies we met with, and from people with disabilities themselves, was that in designing supports for individuals with a disability, the focus should always be on the needs of the individual and their families. So those are the key policy implications sort of flowing from the analysis, the underlying analysis. In this terms of the specific where our research sort of comes into play with the proposals in the green paper, as I said earlier, the breadth of drivers of cost disability which we found and which we were able to show evidence of did demonstrate that really to respond to this requires a whole of government approach. There are need for significant increases in services for some people, grant income for others, and obviously ongoing payment in other circumstances. So the green paper, we note in that context, is focused on reform of disability payments, and as such doesn't really go into that whole of government approach. But of the proposals in it, the approach to tiering payments based on the levels of disability and work capacity is broadly aligned with our findings, in terms of trying to target any additional resources at those most in need. Now, as Chris said, it's not a granular cost of disability payment based specifically on the costs faced by individuals, but it does move in the direction of targeting additional resources at those most in need. And then also, obviously, the increased in-work supports are very much aligned with our findings, given the low levels of employment evident amongst those living with disabilities, and the importance of improving that, both, as I said, to allow individuals to meet the identified costs of disability with earnings where they can, and also the evident, social inclusion aspects of increasing in employment. So that's a sort of whistle stop tour through the cost of disability research. Again, we're delighted that it's informing the work of the department, and looking forward to discussing further. Thank you.
Thank you, Brian. Our final speaker is Ronan Hessian, who is the Assistant Secretary in the Department of Social Protection, dealing with disability and employment issues. And Ronan and his team have produced the Green Paper proposals as a basis for discussion, and very anxious to hear what your views on them are. So, Ronan, very welcome.
Thank you very much, Etna. And just to explain that Etna was among the people who interviewed me for this job. So to some extent, it's her fault. So yeah, Ronan Hessian, I've met many of you before at previous consultation events, and hopefully be meeting many more of you again as we work through the consultation process. So what I want to do is just give you an overview of what's in the Green Paper. And again, to emphasize that the real purpose of today is to make sure you have the information you need to inform your submission and to participate in this process. So you've heard the international perspective from Christopher, you've heard the Indicon analysis from Brian, and that was something actually from the previous consultations. People had said to us, that's quite a technical report. It came out at a time when, it was close to the budget. We'd like just to check in again, just and clarify what that means. So we just wanted to include those aspects so that you have the broader perspective in terms of what we're talking about here. And again, the Minister emphasized this, and she has attended 2 of the previous consultation events. She's very committed to this work. But as she has said, and this is very important to emphasize this, the Green Paper is not a way of cutting payments or reducing people's payments, okay? It's about helping people. It's about looking at if the core question that sits behind it is that if we don't have an unlimited budget, we don't have unlimited resources. So the question is, how do you decide and how do you work out the best way of supporting disabled people financially over and above what's already there? Second question is, for those who can and want to work, what's the best way to provide that support? They're the 2 questions that the Green Paper is really wrestling with. And as the Minister said, she has an open mind on this. The government has an open mind on the Green Paper. Because I know the timing of the Green Paper, some people sort of wondered, was it a decision that was being announced around budget time? But just to be clear, this is not a question of the Minister or the government saying, here's what we're going to do unless you yell stop, okay? The idea here is to give you a concrete proposal that shows you what one possible future version of reform could look like, as a way of helping you understand. And those of you who've heard me speak before will be familiar with my IKEA analogy. So the way I've described the Green Paper is that if I said to you, design a kitchen, you would say, I have no idea where to start. But if I brought you to IKEA and said, that's what a kitchen looks like. Everything is customizable. You can change, add things that you want to see, take away things you don't want to see. And also, it's not a real kitchen. The tap doesn't work and it's not plugged into the electrics. But you kind of need to see one in order to make up your own mind about what you'd like to see. So think of the Green Paper that way. We've used this approach previously in job seeker payments, and we used it to reform of pensions. And the feedback we got that it was a helpful way for people to see one coherent picture that they could then react to. So think about it that way. In terms of where this is coming from, so for those of you involved in sort of dealing with ourselves and other government departments over the last number of years, or for those of you who are just attending from your own sort of personal experience, these are the main sort of policy commitments that the government has entered into over the last number of years, which explain why it's bringing forward a Green Paper. So we have the roadmap for social inclusion. A straw man in a Green Paper is the same thing. We need to look at recognizing that there's a continuum of disabilities, and we also need to support employment where we can, and also look at the question around domiciliary care allowance, which Christopher touched on in his presentation. And of course, the programme for government, to refer back to Brian's presentation, to use the cost of disability report to inform the future direction of policy. And again, I can say the future direction of policy hasn't been decided. Purpose of today is to help you have the information you need to give your input to that conversation. So looking on, as I say, I want to make sure I finish on time so we have enough time for questions. And again, just thanks to the gentleman there who raised it. There will be roving mics. For those of you who prefer Slido, you can use Slido. And we'll also, if you don't want to speak to the microphone, and we're prepared to hand up a written question that one of our team can read, we'll facilitate that too. And again, thanks for raising that. And we're happy to take that on board for the future events as well. So as I say, Brian's presentation covered it, so I won't spend too much time on it. But one thing I just want to mention is that when we had previous events, people were asking about what about the issues around transport? What about the issue about the availability of treatments, about the waiting list and so on? So what I can say to you is that the cost of disability, as Brian said, is a whole of government report. So every department's going to have to do its bit. What our minister is trying to put forward in the Green Paper is to say that she's serious about responding to the cost of disability report. And the Green Paper is part of her way of saying, and the government's way of saying, when it comes to social welfare payments and supports for employment, this is how we're trying to respond to the cost of disability report. It won't address everything, so we need just to be upfront about that. We need everyone in the system to do their bit, but we're not using any sort of delays in that as an excuse for us not to do our bit. So that's what we're trying to say here. Obviously, the UNCRPD, the United Nations Convention on the Rights of Persons with Disabilities, a very important input to our thinking, to the wider debate on disability, and it's very important to the context of what we're doing here today. Obviously, the whole of the convention is important, but particularly Article 27, looking at the right to work on an equal basis. We want to try and improve the employment opportunities and scope for people, the right to an adequate standard of living and social protection, so trying to address that through higher payments. And then also in how we engage and how we consult and how we conduct the conversation, that we do that in a way that's respectful, inclusive and accessible. I won't delay too long. They're slightly different figures Christopher has used, but broadly speaking, the trends are the same. These are the stats that are used in the Green Paper itself. And so what you see is that disabled people have a much higher risk of poverty than the rest of the people in Ireland. That in terms of employment gap, the disabled people have an employment participation rate that's about half of the wider population, which is not only lower than the rest of the people in Ireland, but it's lower than disabled people in other countries. Now, it is difficult to compare across countries. Every system, there is an element of apples and oranges, but nevertheless, I think we accept, and the Green Paper is drafted on the basis that we accept there's a high cost of disability, we accept that there's a high risk of poverty, and we accept that the opportunities for disabled people to participate in employment are lower than they should be. So the net point is that we can't stay where we are. So at the very least, whatever comes out of this process should be better than what we have at the moment. That might look like the Green Paper, might look like something different. And you have a part to play in that. There are the trends we've seen over the last number of years. Christopher outlined where Ireland is in the international sort of comparator across other OECD countries. But you can see there, we are trying to support people. The number of people on the payments is increasing. The costs on these payments, and that we've domiciliary care allowance included there. There's also obviously carers payments, and not to mention payments in the education system, health system. But from the social welfare system, we're spending about €3 billion a year. So the current trends are on the increase, and we see particular something that likes the domiciliary care allowance. We've seen an increase in the last number of years. One thing I will say on that, though, is that the purpose of the Green Paper is not a cost-cutting objective. Our rough estimate of, if you were to pull a lever and implement the Green Paper tomorrow, we think it would cost about 130 million extra. So the purpose of the green paper is not cost cutting. So I'm showing you those trends. It's not to make that point. So I covered some of this already. This is a consultation document. It's not a final design. And in fact, on the pensions green paper, and also when we're looking at the outcome of the consultation on pay-related job seekers benefit, we've learned a lot from the consultation process, and it's adjusted our thinking. So nothing's going to change now, and nobody will lose or have the payment reduced arising from the green paper process. So let's get into it. What does the green paper say? Now, obviously, there's a lot of detail in it, so I'll just try and give you the highlights. And there's some opportunity in the workshops and in your later consultation process to address detail points. But essentially, at the moment, disability payments, you have two doors in, really. Either it's a means tested payment. So, for example, disability allowance. So it's based on what income you have. Or you can qualify based on your PRSI contributions. So if you have a work history and you've been contributing PRSI, you can qualify through invalidity pension. And that's obviously not a means tested payment. So we're going to keep that structure. But what we'll do is, in the same way with pensions, you can get a pension either through your contributions or through your means test. We'll have the same for disability payments. So they won't be characterized as two completely different schemes, but the two doors into them will remain the same. We're not proposing changes to the means test as such in the green paper, but there is a proposal on working age payment, and Christopher mentioned about, consistency across single working age payments. So I'll touch on that in a few minutes, but essentially the two doors will remain: a means tested door and a door through contributions. And then the payment will be based on 3 different levels, different payment levels, different level of employment supports based on needs. So this is roughly speaking how the tiering sort of looks. So for people who need a high level of support and who have a very low capacity to work, it's proposed that the payment rate would be set at the state pension. So roughly speaking, that would be about a €45 per week increase for people in that category. In terms of employment supports, they would just be at the request of the person concerned. And for people in that situation, there's no further sort of reviews, etc. That's effectively a permanent position. For people in tier 3, so these are people who need a lower level of support, have a moderate or high capacity to work. And in that case, as Christopher pointed out, there's a role for intro there and the types of supports. So people have been asking us, what do we have in mind in terms of employment supports? To some extent, like what we're already doing, there's about 26,000 people who were already with disabilities who were already helping through employment supports. Either there, but 16,000 people on our payments who are also working. We are also supporting people through employability, through what was previously known as the Ability Programme. We're also supporting people through community employment, through the Rural Social Scheme, TOOS. And of course, there are other schemes where we have the Workplace Experience Programme, which is sort of a placement service. And we also provide incentives to employers. So about 26,000 people already that of our customers and people we deal with are in employment in some form. So we want to try and build on that. And it's one thing in particular we'd like to hear from you in submissions. I think that's an area where we will have to experiment and try things. We did a pilot project up around Dundalk recently for lone parents, because lone parents have a very low employment participation rate. And what we did is we tried a digital project. So we give them a loan of laptops, and we did wraparound supports, which involves getting your CV ready, getting ready for work, but also things like home budgeting, cooking, stress management, time management, all that kind of stuff. And really what we did is we worked with one of the NGOs, a group called One Family. So we worked in partnership with them, and 2 other countries, Greece, Finland, did the same thing. And it was an experiment to see what might work for lone parents, built around the individual rather than us saying, here's our service, come and get it. And that scheme will run till about April, and we look at the lessons learned. I think to some extent, when it comes to employment options here, we'll have to experiment a bit as well. And I think we'll have to pilot different things. So it's one area where I think, and I would say across all this, as a department and a minister said herself, we don't have all the answers. So this is an area where it's not just a question of tell us what you like or don't like about the green paper. Tell us what policy alternatives. They're also, we need to kind of get your ideas. And then in the middle tier, so these are people with a medium support, low, moderate capacity to work. It's a sort of in-between level of payment. So like returning to my IKEA analogy, right? An IKEA kitchen, obviously you turn on the taps, they don't work. You turn on the lights, they won't work. The full detail of how we will draw these lines, we will have to work through if this type of model were to be the favorite model. So we can't answer every question on it. But what I will say to you is that it's not proposed to do a basic medical or functional assessment. The model, and at the previous stakeholder groups, we had our Chief Medical Officer, Dev Singh, go through what's a more holistic approach. So it's a more comprehensive approach called the biopsychosocial model, which looks at your condition, what are your personal circumstances, what are your supports, what's your work environment, your home environment, and tries to help there. But again, there are always judgment calls around this. But what we will say is that of the 220,000 people who are currently on our two main payments, obviously we've had an assessment process for those. We do use this three-tier approach already for what we call partial capacity benefit, which is for people who are returning to work and retain a portion of their payment as they return. So it is a more expansive version of that, but do give us your views on it. Another important part is the schemes and the various payments have evolved over time. So they all have the hallmarks of incremental change. And so there are certain inconsistencies and anomalies in the system. So for example, common definition of disability. By the way, I'm not saying that there's a single all-purpose definition of disability in its own right. This is for the purposes of our schemes. So for example, the definition of disability for disability allowance is about a condition that's going to last longer than a year. For invalidity pension, it's either a permanent incapacity or an incapacity that lasts 1 year already and is going to last at least another year. Invalidity pension, you go into at 18, disability allowance at 16. That's what we're talking about. It's having a sort of more consistency and more logic to the rules. Obviously, at the moment, and Christopher mentioned the position of illness schemes. We have disability schemes that last a year or illness schemes that last 2 years. So in ways over the years, as the system grows and changes, some of they don't line up as well as if you were designing it from scratch. So we want to revisit that. The issue of disability allowance becoming available at 18 and with domiciliary care allowance extending to 18. This is a very sensitive subject. It was raised in previous consultations. We did have an extensive consultation. For those of you who remember the Make Work Pay report, we did workshops and we met people. Broadly speaking, what people said is about half of the people we consulted were in favor of the change, about a quarter were not in favor, and a quarter were not sure. So it's still an area where we expect there to be a range of views. So this is an opportunity for us to check in and to see what's your view on this change at this point in time. The area of common in-work supports. So we have, if you're on invalidity pension and you go back to work, you may retain some of your payment, as I said, under partial capacity benefit. In disability allowance, we have the system of disregard. So you keep your payment up until about €495. It starts kicking in about 165. So looking at sort of common in-work supports. Now, one model, and Christopher mentioned this in his presentation about whether there should be just effectively one working age support, or effectively a common universal payment with top ups on top of that. So one thing we have consulted before on, not in the context of disability, but for job seekers, is what's called a working age payment model. At the moment, disability allowance, because of the disregards, people are concerned not to go above the disregard level for fear of losing their payment, and in particular secondary benefits. So this is built on a payment called working family payment, which basically says for your situation, there's a certain level and you get 60% of the difference between what you earn and that level. So basically what it means is that if you're working and still claiming some welfare, it should still be in your interests to do additional hours if that's what you want to do. It is quite complex, but just to say that we're signaling there that we are open to thinking outside the box in terms of how we manage payments for people who want to work to some extent, but still need to retain some of their payment. And just an important point, it's not on the slide, but we're not proposing a change to secondary benefits. Just, I know people are very concerned. What does this mean for medical cards? What does this mean for, free travel and so on? So we're not proposing you would retain those as you currently do. So just to say on the consultation process, we had a stakeholder consultation in October. Today is the 9th of November, where we're having this wider consultation, and thanks to all of you for joining us today. I know it's difficult to find time and it's a lot of effort to come here, and special thanks as well to those who are joining online. We will have further public consultations in Cork and Athlone coming up. So in addition to your feedback on the green paper, if there's anything, we had issues came up earlier, which we'll address and we'll take on board for the future consultations. If there's other things we can do better, just tell us. We're happy to build a consultation around what suits you. To disabled persons organizations, I'll repeat what I said at the previous event, which is that we are available to meet bilaterally. So we're happy to sit down with you. We can meet you in your premises, or you're welcome to come to meet us. We're happy to sit down and talk things through. So do let us know. Let us contact me or anyone on the team, or through the consultation email address if that's something that would be of interest to you. We've several meetings already lined up. And I know some groups perhaps want to just have a think about the green paper, consult with their members, and then maybe meet us. So that's fine too. And as the Minister said, the deadline is the 15th of December. When we did the consultation on the Indicon, the cost of disability report, we pushed out the consultation period at the request of groups. I did the same as well, I think, on the reasonable accommodation fund consultation. Did we, Adrian? I think we did. Yeah. So if you need more time, that's fine. But just give us your feedback on what sort of period you have in mind. And again, the submissions can be made through email, paper. We also do videos in various accessible formats. Any questions on that, just let us know. Just one other point I just want to mention, because it has been raised with us, people just wanting clarification around confidentiality and data and so on. So obviously submissions received from groups we will publish. You're part of the stakeholder group. If you submit an individual submission, the submission will be available, but not your details, not your name or address. It will be anonymized. Myself and my team, we have no access to claim information. I don't know who's on any payment, and I don't have access to our computer systems to even look it up. And in fact, if I did look it up, I'd be in trouble. So there was some people, I think, concerned that if they were giving their submission and they gave their honest view, which is what we want to hear, that would somehow affect their payment or their situation. Just to assure you that's not the case. And you can take our bona fides on that not only is it not the case, but we want people to feel that this is a secure and open consultation process. We've given presentations. Christopher's presentation is thought-provoking, for us as well as you, I'm sure. It's not just about getting you to engage on our terms. It's genuinely a chance to give your full opinion. So I think I'm just about inside time, Etna, and hopefully that gives people enough. The format. We'll probably have questions up until 12. If you can keep your questions to questions, we can do the comments, if you like, in the workshops, and they'll be fed back. But just to be fair to everyone who wants to contribute, keep them as focused as you can. And we will then go on to lunch after the questions, then workshops, and then we'll have feedback at the end. So thank you very much for listening.